Good morning, my name is Linda and I am in class BSN 246. I will be performing the NG tube insertion. First thing I'm going to want to do is check healthcare providers' orders and collect supplies that are necessary in order for me to perform this skill, which will include the emesis basin, a towel or chuck, the NG tube itself, some tape, pen light, cup of water. I'm gonna have here my pH, just pretend my pH strip to test the stomach content, the 60 ml piston syringe, stethoscope, safety pin. I don't have a elastic band, but we'll pretend, and also any type of suction apparatus, tubing, or canister. We'll pretend that we have that for my scenario. So once I've collected all the things and supplies that I need to perform the skill, I'll go ahead and proceed to the patient's room. Go ahead and knock. Good morning, my name is Linda. I am your nurse today, and I was given orders to insert an NG tube. Do you know why and how it's done? The patient may or may not know, and if they don't, I'll go ahead and explain to them why they're having the procedure done, whether it be an easier way to for nutritional purposes or to administer medication. This is why the doctor's wanting it to get done. If you have any questions, concerns, go ahead and ask me. Patient states that they don't, so I want to go ahead and ask them what is his name, date of birth before we continue. Patient's going to tell me his name is John Doe. Okay, John Doe. I'll check his wristband. So now I have, two identifiers that this indeed is the patient that I need to perform this procedure on. So once that's done, I'm going to go ahead and close the curtain, close the door, provide patient privacy, and make sure that the patient, any questions, concerns have been addressed. I'm going to go ahead and raise the bed up to the level that will be easy for me to perform the skill, and then raise the patient in a high feller position. Once the patient is ready, everything's been answered, I know it's the correct patient, I'm going to go ahead and provide hand hygiene. I'm going to go ahead and don my gloves and continue to talk to the patient, explain to them that the procedure shouldn't hurt. It may be a little uncomfortable. They may have a sensation of gagging. If they do, to go ahead and raise your hand, let me know. I do have here a cup of water, and sometimes swallowing, drinking water assists in navigating the NG tube. So let me know. Also, when I'm doing this, inserting it into the patient's nostril, you want to go along with the curvature of the tube to makes it a little bit easier. But before all that, I want to go ahead and assess the patient's ears to see which side I'd like to have it performed on or in. So with my pen light, I'm going to go ahead and check left side, right side. I'm checking for any type of occlusions, deform maladies, anything that would obstruct and prevent me from inserting this into their nostril. I'm going to go ahead and cover the left side, occlude it, have the patient take a deep breath in and out, and then again on the other side. And then after assessing, I have determined that the left nostril airflow is a lot smoother. So I'm going to go ahead and use the left side. So then after I do that, I'm going to go ahead and let's pretend I'm placing the chuck or towel onto the patient's chest. Here's an emesis basin if we need it. Again, reiterate that if the patient is feeling any type of discomfort, to go ahead and raise their hand. And the other thing after I assess which side I'm going to use is I need to measure to see how deep in we're going with this tube. So to show you, we're going to go from the tip of the patient's nose to their ear down to the xiphoid process. Okay, so once I do that, it's about 50, okay? Now, if this was not labeled, which this tube is, I would then at that point use a marker or some sort of piece of tape so that I know where to stop. But this, they have numbers on it, so we're gonna say 50, okay? So once the patient is good to go, I'm ready with my supplies here, basin, towel. I know which side I'm gonna use. I'm gonna go ahead and place this into a basin of warm water. And that's basically just to allow, not maybe, but the warm water, it's believed to make the plastic a little bit more flexible and easier to navigate as I'm inserting it into their nostril. Okay, so a few minutes have passed. I'm gonna go ahead, ask the patient if they're okay. I'm gonna go ahead and put some KY jelly, like this. I'm gonna ask the patient to go ahead and to hyperextend their neck. I'm gonna go ahead and insert the tube into their nostril. I'm gonna go ahead and follow the curvature of the tube along the floor of the nostril. Now, if at any point the patient begins to cough, is complaining of any discomfort, then I would remove the tube. I'll give them a moment to collect themselves, re-lubricate, and then try on the other side. So here I am. I'm gonna keep going 2 to 4 inches in. Patient starts to gag. At that point, what I'm going to do is have the patient place their chin down to their chest, offer them some water. Here you go. And as they're swallowing, I'm gonna go ahead and continue to insert 2 to 4 inches in and continue. And they want some more water. Okay, go ahead, here you go. How are you doing? Are you doing okay? And we're almost there, almost there, almost there. And then we finally get to the mark, 50. Okay, are you doing okay? That was the hard part. Patient says yes, they're okay, a little teary-eyed. I would be too. Once the patient, we've reached the point where, with my measurements, we believe that we're in the stomach area. Now it's time to check for placement. So what I would do is order a abdominal x-ray. But in the meantime, prior to having that done, I am going to, with my syringe, I am going to remove 5 to 10 mLs of gastric contents, stomach juices here. Okay, kink the tubing so we don't have a mess here. Are you doing okay? Okay. Then I'm gonna place it into the cup. Okay, 5 to 10. I'm going to test it with the pH strip, depending on the facility that you work at. Some people have 1 to 5, 1 to 4. So long as it's below 5, it's fine. Okay, so we're at 3, so we are in the stomach area, or in the stomach. But to make sure, the number one way is obviously through an x-ray. Okay, so once we know for a fact that it's where it's supposed to be, you want to anchor it with some tape. I already went ahead and pre-cut it. I just made a little slit 2/3 of the way. And this is going to be placed onto their nose. You want to wrap the tape around the tubing like so. It is a little hard with gloves, but okay. And same thing with the other side. Okay, so once it's anchored like so, we're gonna grab the other side, and with the safety pin or the elastic band, we're gonna pretend that we pinned it onto their gowns so it's not like hanging loose all over the place. X-ray. The abdominal x-ray has been performed, and placement has been confirmed that it is in proper placement. Once that is done, I'll go ahead, and in my scenario, I'm gonna go ahead and put this end, plug it into the wall to the suction, the canister. That's what the purposes of this NG tube for me. So once that's in there, I'm gonna ask the patient if they're okay. Do they feel all right? Everything's okay. I'm gonna go ahead and lower the bed to the lowest position, put the patient into semi-Fowler position, because I'm sure they're tired of just sitting upright like that. I'm gonna go ahead and gather all my supplies, clean up my mess, remove my gloves, perform hand hygiene. And then at that point, I'm gonna go ahead and start documenting how it was performed, how deep I went into the patient's nares, patient, assessment, and how the patient overall did while I performed the procedure. That's it. You're good? Good. Thank you.